In the United States, we spend about $4.3 trillion a year on our healthcare. It's more than the next 20 countries combined. We spend about 90 cents of every dollar treating chronic conditions.
Welcome to the Experience Health Podcast. I'm your host, Rachel Vassar, an online holistic health practitioner, helping high achievers conquer weight loss resistance, gut issues, and low energy by getting to the root. On this show, we're shifting the paradigm on healing through nervous system regulation, functional nutrition, root cause protocols, and sustainable life changes. If you're ready to reclaim your energy, restore your health, and feel like you again, you're in the right place. So let's dive in. Welcome back to the Experience Health Podcast. I'm your host, Rachel Vassar, and today we're diving into the topic I know many of you care about: why true health doesn't come from simply finding the right drug. My guest today is Dr. Kevin Smith, a board-certified functional medicine practitioner with over 2 decades of clinical experience. He diagnoses and treats complex, often misdiagnosed health problems without drugs or surgery. He's also a public speaker and the author of 2 books on functional medicine, with his second book coming out later this year. Today, we'll unpack why our culture is so focused on prescriptions, the real drivers of chronic disease, and how a root cause approach can help you heal in ways that medication alone cannot. Dr. Kevin Smith, welcome to the episode.
Thank you very much, Rachel. It's an honor and a privilege to be here.
Absolutely. Diving right in, tell us a little bit more about yourself if I missed anything.
Okay, so I am by trade a doctor of chiropractic. That's my base degree. And on top of that, I'm board certified in clinical nutrition, and I'm a functional medicine practitioner. I've been doing this work for about 25 years. I'm the author of 2 books. The second one is going to be released later on this year. It's in editing right now. And I'm a public speaker. And I'm very passionate about what I do. I try to help as many people as divinely possible to natural health care.
Love it. Thank you so much. So I want to kind of start at the basics for people to get a basic understanding of what we're talking about here, because a lot of people don't understand what functional medicine is. So I will love with a brief explanation of what functional medicine is for you.
Okay, so perfect. So there's 2 broad categories of healthcare in this country. There is allopathic healthcare, which is what medical doctors do, and there's functional medicine, which is a different type of approach. With allopathic healthcare, the goal is to suppress a symptom. And so they use medications. Medical doctors use drugs. So if you have high blood pressure, they give you a drug to help with that symptom. If you have high abnormal thyroid function, they'll give you a drug to help to regulate your thyroid. So they're all about the symptom relief. With functional medicine, one of the things that we do is we ask why. Why does the person have these problems? What is the root cause that's driving the issues? And so there's no such thing as having a problem just because. There's always an underlying root cause that's driving the problem. So if you have thyroid issues, what is the reason why that thyroid function is not normal? What's the reason for having low energy? What's the reason for having weight gain, even with diet and exercise? So that is the main reason, the main difference between allopathic versus functional medicine.
That's a really good explanation for people to understand the difference. And I think even that explanation alone will help a lot of people understand why they're not actually getting better. They're just feeling maybe their symptoms suppressed, maybe.
Right.
Most of the time they experience more symptoms after they get on certain medications. But yeah, thank you for that explanation there. I'm curious, in your opinion, why do you think that the U.S. healthcare system has become so drug-centered?
That's a very complex question and it has a lot of different components. We live in a drug culture. And so whenever you turn on the TV, whenever you turn on the radio, whenever you open up a magazine or read a newspaper, there's always a drug ad. And it's one of the reasons why your drugs cost so much money, is because they spend so much money on direct to consumer marketing. Big Pharma currently spends $12 billion a month on these drug ads.
Wow.
And the United States and New Zealand are the only countries in the world that this is allowed. They don't allow direct to consumer marketing in England or Spain or Germany or France or Japan. No other country you're going to see a drug ad except for New Zealand and the United States. And interestingly, New Zealand and the United States have the highest cost per capita of healthcare in the world.
Hmm. Interesting. Yeah. So the ads is like the most, I guess, a really big reason why a lot of people are getting on these medications because of what they see online.
Well, every time you turn on the TV, it doesn't matter which channel you're watching, which network you're watching, what time of the day it is, you're going to see a drug ad. You're going to see an ad with happy people that the last thing it said is talk to your doctor to see if blankety blank drug is right for you. And they condition people over and over and over again to want to reach for a chemical, a drug of
Mm.
some sort. So if you can't go to the bathroom, there's a drug for that. If you have indigestion, there's a drug for that. If you have headaches or migraines, there's a drug for that. If you have uh, autoimmune disease or Crohn's disease, for example, there's ads for that. So there's ads and ads and ads, and there's so many that's the culture that we've grown up with. It creates a drug culture. It creates a want for that. So, I mean, medical doctors, they really don't have to market. It's done for them by the pharmaceutical companies.
Yeah. Yeah. Well, that's super interesting. In your view, I know you're talking about the difference between treating with drugs versus treating with functional medicine. In your view, can you tell us what is the real problem with relying on drugs to manage chronic conditions?
Sure. So, if it by the time you have a symptom of some sort, so much damage has typically occurred. The symptom is not the first sign of a problem. You can have a problem for a long time before you develop a symptom. So, like for example, my dentist taught me this. You can have tooth decay for 3 years before you develop a cavity that's worked its way all through an animal and caused a toothache. It has to go all the way to a nerve of pain. So when is the first time that you should pay attention to the problem? When your tooth hurts or years before when the tooth decay first starts, right? So every single disease that we know about, everyone, heart disease, cancer, liver disease, um, uh, diabetes, all of these things started long before you developed a symptom. And so, as Americans, we are conditioned that if you have a symptom, you need to go see a doctor. If you don't have a symptom, you're perfectly healthy. Well, we know now that that's not necessarily true. So, you can have a problem. So, the functional medicine model detects problems long before a symptom erupts
Mm.
and long before people say that you need a drug or some kind of a medicine.
And even before the doctors would be able to see it on your labs, because in functional medicine, you compare it to optimal levels, not standard.
Exactly. So when you get a lab test, the doctors are going to order, they're going to go based on what the labs say is normal. The
Hmm.
lab normal is based on everybody that presented into the hospital or everybody goes into the doctor's office with a symptom. So in other words, they're basing it on a sick patient population. In functional medicine, we base things on a normal ideal level. That's the sweet spot. That's where you really should be,
Yeah.
not all the way up to the extremes. The lab normal is a very wide, forgiving range of tests. So there's a low number and there's a high number. And if your score is below the low number or above the high number, you're already in full-blown pathology. The
Yeah.
functional normal is based on a middle ground. That's based on a healthy patient population. And if you ask most people, who would you rather be compared to? Sick people or healthy people? Most people would say, I want to be compared to healthy people. And that's not what the medical doctors do. They just based it on a sick patient population. So in conclusion, the lab normal, which is the lab uh, what the lab states is normal, that's what the medical doctors go by whereas in functional medicine, we go by a tighter, less forgiving range.
Absolutely. And that helps you in uncovering dysregulation that's going on in the body before it turns into a clinical condition. Correct?
Correct. So we can pick up things long before they can because we're using a tighter, less forgiving tolerance.
Yeah. How many times have you taken a look at your patient's labs um, and uncovered like a lot of dysregulation that's going on in their body, but if their doctor looked at this, they would tell them they're completely healthy?
Well, most of them actually. Most of them are. Yeah, when I
I knew
run.
your answer before I asked the question, but
Exactly. So the doctors, when the doctors look at a lab panel, when they look at the lab reference interval, then that's the only metric that they look at. I can find a whole lot of things that are out of bounds, out of normal, long before they can pick up any kind of an issue with it. There's their only goal with drug therapy is to suppress a symptom, whereas in functional medicine, the goal is to help the person get healthier. So
hmm
functional medicine is a personalized, patient-centered approach to healthcare. We're not looking to chase after the symptoms. We're looking to get the person better.
Yeah, absolutely.
And as a
Absolutely.
follow-up comment to that, if I could,
Yeah.
if you wanted to test this theory out, and first of all, I'm not anti-drug. I'm not
Mhm.
anti-physician. I believe that there's a time and a place for all healing. So,
I was
for
actually about
example,
to ask about that. Yeah.
so if somebody's having a heart attack or a stroke, or they have a gunshot wound, or they have a broken bone or a burn or a laceration, doctors trained in the United States are the very best in the world at
Yeah.
treating that stuff. They are phenomenal. If I'm having a heart attack, I'm not going to go to a chiropractor. I'm going to go to the emergency department. Do not
Yeah.
pass go. Do not collect $200. But when it comes to managing chronic issues, they don't have a good track record at all.
Yeah.
So they things like diabetes, thyroid disease, high blood pressure, things like that. Um, when it comes to curing a chronic problem, well, let me just say that in the United States, we spend about $4.3 trillion a year on our healthcare. It's such a great amount of money. It's more than the next 20 countries combined.
Oh
And
my
of that
gosh.
$4.3 trillion, we spend about 90 cents of every dollar treating chronic conditions. That's 90% of all all that 4.3 trillion treating chronic problems, which the medical doctors do not have a good track record of
Yeah.
success. I really can only think of one disease that you can cure by taking drugs, and that is with a bacterial infection and you're treating it with antibiotics. I
Yeah.
cannot think of any other disease that if you treat it with drugs, you're going to cure it. So, for example, one of the most common issues that people face in the United States is high blood pressure. So, if you stop taking your high blood pressure medications, what do you think is going to happen? It's going to go right back up,
Yeah.
right?
Go
So,
right back up. Not actually fixing the issue. Yeah.
right. The doctors don't cure it. They just mask the symptoms. They just
Yeah.
temporarily suppress symptoms with a drug. That is not a cure. So, looking at what is causing the high blood pressure, is it because of your diet? Is it because of your body weight? Is it because of uncontrolled stress? Is it because of some problems with your kidneys or something else? So we want to dig a little bit deeper and find the hidden root cause of this problem.
Yeah. Uncovering the root cause is definitely a really important piece. I love that you were able to distinct between where the medical system has a very important part in keeping people alive, especially in emergency situations, or if you have a bacterial infection, like antibiotics will save your life.
Yeah,
Very
I mean,
important.
medical doctors, there's a role for everything.
Yeah,
There's a
absolutely.
time and a place for medications. There's a
Yeah,
time and a place for surgery or chiropractic or physical therapy or anything. So, but with functional medicine, my goal is to treat the person to get them more healthy
yeah,
and to identify, and then uncover the hidden root causes. of say, well, let's take thyroid problems for an example.
Yeah.
One of the things that is the root cause of thyroid issues is autoimmunity. So, with autoimmunity, the immune system is your body's defense system. So, if you have a bacteria or a virus or a parasite living in your body, the purpose of the immune system is to go throughout the circulation and then get rid of any kind of invading bacteria or viruses or a parasite or something like that. That's what it's supposed to be doing. It's supposed to be protecting you. But with autoimmune disease, what happens is that the immune system starts to mistakenly attack your own body. And this is a very, very big issue. There's over 100 different autoimmune diseases that have been identified by scientists. And they're all basically named based on which body part is being affected.
Yeah.
If the immune system is attacking and destroying the thyroid gland, which is a small gland in your neck, that is called Hashimoto's disease. And 90% of everybody that has low thyroid issues has Hashimoto's. That's according to the Academy of Endocrinology. Now, the problem here is that the medical doctors don't test for it at all. There's a very simple blood test called a TPO and an antithyroid globulin antibody test that can identify if you have Hashimoto's. 9 out of 10 people that have low thyroid disease have this. And even if they did test for it, it's not going to change their treatment plan whatsoever. The only thing that the doctors know what to do with this is to give you hormone replacement therapy, such as Synthroid or
Right.
levothyroxine, to try to boost
Mm.
your TSH levels and your T4 back to normal. The thyroid physiology is a lot more complicated than that. It has a lot more pieces and parts than that. For example, the liver is involved, the gut's involved, the brain is involved, and the thyroid gland is involved. And there's a lot of pieces and parts that can where it can go wrong.
Mm.
And that's why only 17% of everybody that is taking thyroid medication is going to be helped. That means
Mm.
that 83% of everybody that's taking thyroid drugs does not get help.
Interesting.
Yeah.
Okay. So, kind of going on along the same lines of thyroid autoimmunity, how do you support people? You don't have to go into super, super specifics, but like in general, like how do you support people in improving the health of their thyroid and reducing that autoimmunity, um, when without the medications?
Okay. So, without getting into mind-numbingly
Yeah.
difficult stuff here,
Yeah.
there's different divisions of the immune system. There's the one division called the Th1, and the one division called a Th2. The Th1 division is like the Marines. They go in there and they kill everything. And then the Th2 division is the memory part. So that remembers every bug or antigen that you've ever been exposed to in your entire life. So, for example, if you have chickenpox as a child, you're not going to get chickenpox again later in life because you've already been immune to it.
Mhm.
It's called lifetime immunity. Um, what happens is that the Th1 and the Th2 divisions need to be in balance with each other. And if the Th1 is more dominant and the Th2 is more recessive, that sets the stage for autoimmune disease. Or it could be that the Th1 is more recessive and the Th2 is more dominant.
What
So,
can cause, kind of before we move on, like what can cause like the TH1 versus the TH2 to become dominant or recessive generally?
researchers have debated this for a long time, and they argue back and forth about what is the root cause of what can cause this.
Yeah.
And about 5% of cases have a genetic linkage.
Okay.
95% of cases are not necessarily genetically related, but it could be due to a life effect, such as the birth of a child, the death of a spouse, the death of a parent, a big move to a new location, a new career, a new job, something that can cause a lot of stress
Stress.
and a lot of inflammation in the body.
I
That
see.
seems to be the most prevalent explanation that I've heard of today. Um, I do take that into consideration. I do take a look at all the different factors that the person may be going through and try to
Yeah.
give them some balance with that. Beyond the immune system issue, there are a bunch of different, what I call triggers, that can cause disruption with your thyroid physiology. And when the thyroid gland is not in balance, it's not working right, people have low energy. They have weight gain, even with diet and exercise. They have their hair falling out in clumps. It's especially very sensitive to women because they take a
Hmm.
lot of pride in their hair. And if the hair is falling out, they really freak out about this. They have cracked or brittle fingernail or toenail beds. They can have constipation or diarrhea or both. They can have insomnia or problems falling asleep or staying asleep. They could have low libido. If it's a girl that's trying to start a family, she could suffer from infertility issues. So it could be very, very uh, uh, damaging to the overall function of the person. And so, in order to look at this issue, I want to identify all the different triggers. These are things like anemia, blood sugar problems, cortisol issues, sex hormone balance, chronic inflammation, oxidative stress, gastrointestinal problems, food sensitivities, chemical sensitivities, and stealth infections. And the way that these things can be looked at is by testing. We order blood, urine, stool, or saliva tests, and then we measure, we base our conclusions based on objective lab testing. And we say, this is what's normal, this is where you are. Can you see that you're not normal? And our
Hmm.
goal is to bring that back into balance. And by rebalancing all these little triggers, we can restore thyroid function. It's a very, very different approach than just simply taking a pill and hoping for the best.
Yeah. Absolutely. So once you've identified like those triggers for people who are presenting with thyroid dysfunction,
Yeah.
and you've like understood what it is for those specific people, do you then like how do you target those specific triggers for those people?
So, so once again, I order labs. Let's say, for example, that I suspect that you have a sex hormone imbalance with estrogen, progesterone, testosterone. Remember, boys and girls make both, and they have to
Yeah.
be in the right amount for the right gender and for the age. So, a
Hmm.
22-year-old woman is going to present with a different pattern than, say, a 60-year-old woman. So we taken all those into consideration. We find out, is this normal for the age? We look at the metabolites or the basic building blocks of these different sex hormones. And if there's if they're out of balance, then we try to rebalance the hormones to try to remove and eliminate that thing as a trigger. If they have GI problems, such as abnormal absorption of nutrients or leaky gut syndrome, or maybe the microbiome, which is the ecology of bacteria that lives in your gut, if that's not normal, the goal is to rebalance that to make it normal to eliminate that as a trigger. And if I can eliminate all the different triggers, guess what's going to happen? Your thyroid's going to come back. You're going to feel better. You're going to have better energy. You're going to sleep better. Everything's going to be better for you.
So I don't even have to take the thyroid hormones by working on those root causes. Your thyroid heals once you have worked through the autoimmunity. It's no longer
Well,
attacking itself.
in a lot of cases, yes. In a lot of cases,
Okay.
well, some cases, a person needs thyroid medication. If they have, say, if
Okay.
they're one of the 17% of people that genuinely has a sick thyroid, then they have to be given thyroid replacement hormones such as Synthroid or Tyrosint or Cytomel or
Okay.
levothyroxine, some kind of a drug that is prescribed by either their family doctor or by an endocrinologist. I work with the other 83% of people that's those drugs aren't even going to help them. So
Yeah.
really the big issue is when I do a consultation with somebody, I ask them at the beginning, what have you tried so far? What have you done for this? And I'm looking for them to say, I've been to my family doctor, I've been to an endocrinologist, I tried the medications. and the medications aren't working. What do I do? And that is really the person that I'm looking to zero in on. I,
Okay.
this is not, this approach is not going to fix everything. It's not
Yeah.
going to fix everything under the sun. But really, what I'm trying to do is I'm trying to get people more healthy. And a lot of times, a lot of this that I do is based on lifestyle modification, making sure that their diet is correct, their diet's right for them. There's no one nutrition plan that's right for everybody. So one person may do very well on a Mediterranean diet, one person may do very well on a paleo diet, another person may do very well on a carnivore diet. So it all depends on their needs and their wants. And then I use certain supplements to just do that, to supplement a healthy diet. I mean, you can't go to McDonald's 6 days a week and then take a multivitamin and expect it to work very well.
I
So
know
you got,
someone I know someone who their doctor told them that they don't have to worry about their diet if they're taking a multivitamin. I was like, "Oh,
wow.
no."
Oh, I'm sure that may happen every once in a
Yeah.
while. You know
I
what's
haven't
funny
heard
is
that
that
from anyone else except for that person, but I was like, "What?" Okay. Anyway.
what is weird is that medical doctors that I'm friends with, they are very much in tune with the wellness lifestyle.
Mm,
They all exercise, they all watch their diet, they all manage their stress as best as they can. They have a pretty stressful job.
yeah.
And but then they go to work and they prescribe drugs for people. And there's a little bit of a disconnect there. I think, like I said, I don't want to undermine the effectiveness of medications.
Yeah.
They are very effective for certain problems and certain issues. But when it comes to managing a chronic condition, I want to start with the basics and work on things like diet and exercise and stress management, making sure that your nervous system is working right, making sure that you're um, all the fundamental things. Are you
Yeah.
paying attention to ergonomics? Are you flipping and rotating your mattress and making sure that your chair is set up correctly for your body so you don't get back pain, things like that?
Yeah, absolutely. I wanted to go slightly back a little bit to what we were talking about the thyroid medication because I'm just
Okay.
super curious. You mentioned that like you take the people who have tried the thyroid medication and it hasn't worked for them.
Yeah.
I'm curious, like, do you recommend people who have autoimmunity to try medication first to see if that works for them, or is it not necessary? What are your thoughts on that? Because
So
I learned from my mentor that like sometimes it's necessary to do the medication, like depending on the individual. Is it like severity of their symptoms or stuff like that?
it's a difference mostly in philosophy of what you want to try to achieve. When
Okay.
medical doctors treat autoimmunity, their goal is to give the person an immunosuppressant drug, something that's going to downplay the immune system so it's not beating up the body so much. So if you ever look at the drug ads on TV, let's say that the person may have an autoimmune disease such as Crohn's disease. They're going to give them a drug that's going to suppress their immune system. It's not going to cure the problem. It's going to suppress their symptoms. Um, I should say that when it comes to autoimmunity, autoimmune disease cannot be cured. There's no such thing as curing an autoimmune disease. Anybody
Mm,
that tells you that they can cure it is lying to you. Now, while you can't shut it off by flipping a switch down, you
yeah.
can dim it down, like you can dim down the chandelier to your dining room lights, and you can put the person into remission so the immune system is no longer causing mischief and no longer causing destruction of their body. And that is the best approach that I've ever heard of. And that's really the whole thing that the medical doctors want to do is to put it into remission.
Yeah.
They recognize that you can't cure it. They want to
Yeah.
put it into remission so it's no longer causing the damage. Now, the other thing with immune disease is that immune disease is kind of like a schoolyard bully. If he's picking on kids over here, he's probably also picking on kids in other places too. So when a person has been diagnosed with an immune system issue, an autoimmune disease, they very often have multiple areas of involvement that it's going on. So, for example, if you have Hashimoto's disease and your thyroid gland, you probably also have issues with the brain or the gut or the skin or any part of your body. And
Yeah.
so these autoimmune diseases are basically named after what part of the body is being affected. If you have autoimmune attack in the brain, that's called multiple sclerosis. If you have autoimmune attack on the hands, the joints in your hands, that's called rheumatoid arthritis. You've seen seniors with their hands all knurled up and disfigured. That's rheumatoid arthritis. That's not wear and tear arthritis. That's because
Mm.
of an autoimmune condition. A variant of rheumatoid arthritis is called psoriatic arthritis or psoriasis, and that affects the skin. So people that have breakouts in the skin, that's a variant of rheumatoid arthritis. And if it affects the lung fields, that's called sarcoidosis. If it affects the colon, that's called Crohn's disease. All of these things are examples of autoimmune conditions. And the goal with that is to rebalance the immune system so that it's not causing problems. And we can do that very effectively without drugs and without surgery.
Okay, so you believe that you can put autoimmune conditions into remission without having to start or use immunosuppressants? Is that
Absolutely.
correct? Okay. Okay.
Absolutely. Yeah,
Amazing.
that's one of the first things that we want to do. And when you have Hashimoto's, one of the biggest things to do is to remove any kind of chronic inflammation. There's two different types of inflammation that the body has. There's acute inflammation and there's chronic inflammation. Acute inflammation is the good kind of inflammation. That's what happens after you fall off a bicycle and you bump your knee. You can get pain, swelling, redness, and heat. Those are the four cardinal signs of acute inflammation. But what happens is with chronic inflammation is that inflammatory process starts and then somebody disengages the shutoff button and you can't turn it off. And that is very, very destructive to the body. And every single disease that we know about, everyone, cancer, diabetes, heart disease, including things that lead up to heart attack and stroke, they're all rooted in chronic inflammation.
Yep.
And so inflammation is very much mediated by what you eat, by what's in your diet. So pro-inflammatory foods include things like sugars and grains and certain dairy products and processed foods, foods that are like made in like deep fried in seed oils, very, very inflammatory to your body, and that will lead to all kinds of bad things to happening later in life. So that's why I'm a big
Sadly, those
advocate.
are all the foods also being marketed to you along with the drugs.
Exactly, exactly. So, for there's now a movement to try to in the fast food industry to try to go back to frying foods in beef tallow versus trans fats. And one of the franchises called Steak and Shake was one of the first restaurants to start to join this movement. And I think as more people become educated and more people become aware of the damage that's being done by frying foods in, say, peanut oil, the less more restaurants are going to jump on the bandwagon. The
Yeah.
biggest reason why these companies use these products is because of economics. It's cheap. That's why they use corn products because it's a subsidized crop, and so it's very very cheap to buy say high fructose corn syrup and put that into sodas and fruit juices and other types of things that are marketed to
Ketchup.
people. Yeah,
It's
absolutely.
in a lot of products that people don't know it's in.
Yes, I agree. I agree. So, managing your intake of inflammatory foods
Mm.
is absolutely critical when you have an autoimmune disease and when you have some kind of a chronic problem that we are trying to eliminate from your body.
Absolutely. And you mentioned it towards the beginning of the podcast episode, managing your blood sugar as well. Um, how do you typically do that with nutrition to support in reducing inflammation and
Okay,
autoimmunity?
so with blood sugar problems, everything starts off with insulin resistance.
Hmm.
And if insulin resistance is allowed to go long enough, it then turns into type 2 diabetes. Now, insulin is a hormone that's produced by the beta cells of your pancreas. And the job of this stuff is anytime you eat food, whether it's a carbohydrate, proteins, or a fat, it takes it breaks those things down into simple sugars that your body can use, glycogen, glucose. And that stuff goes throughout the bloodstream, and insulin tries to take that glucose molecule and shuttle it into a cell where it could be burned as energy to make ATP energy. What happens is that if you eat a lot of carbohydrates, if you eat a lot of uh, bad foods for you, you don't exercise enough, you develop a lot of insulin resistance. So the insulin presents the glucose to the cell, and the cell says, I'm not allowing you in. And so what happens is that the glucose starts to build and build and build and build in your bloodstream until it reaches a point where the lab says that you now have prediabetes or diabetes. So I need to stop a minute and explain something. There are four types of diabetes. Four. Type 1 is called it's juvenile mediated, so it happens before puberty. So what happens is that it's an autoimmune disease. So the immune system, the white blood cells, attack and destroy the beta cells of the pancreas. It shuts down the ability to make your own insulin, so the person's going to need insulin for the rest of their life. Type 2 diabetes, which everybody heard of, is largely a self-inflicted wound that's caused by overconsumption of sweets or inadequate exercise, or a little bit of both. And so the insulin resistance creeps up and creeps up and creeps up until you're in full blown type 2 diabetes. And that is very, very bad. That it predisposes a person to a heart attack, a stroke, blindness, peripheral neuropathy, kidney disease, amputation, all kinds of stuff. There's two more types of diabetes that are very common that a lot of people haven't heard of. One is called type 1.5. And type 1.5 has the same exact mechanism of action as type 1, except it happens during adulthood. So when you're all grown up and you develop an autoimmune disease that affects your ability to make insulin, that's type 1.5. It's recently been discovered. It's in the scientific literature, and in time it will start to catch up to doctors' offices.
Hmm.
And type 3 diabetes is also known as Alzheimer's disease. So there's a direct relationship between uncontrolled blood sugar and early dementia, or early problems with um, forgetfulness, memory loss, loss of cognition, mood issues, all kinds of stuff like that. So, and that's also mediated by taking statin drugs. Statin drugs are known to cause early onset dementia.
Wow. How does the statin drugs or stat
Yes.
drugs? Statin?
Statin drugs
Okay.
are made to decrease the levels of cholesterol in your body. Your brain is 75% composed of fat, and 25% of it is made out of cholesterol. So when you take a cholesterol lowering drug and you apply it throughout the body, it's kind of like pouring paint stripper on somebody's hood of their car. It's not going to just remove the bad cholesterol, it's going to remove all the cholesterol. And
Yeah.
so when you look at the incidences of dementia and early onset Alzheimer's, there's a direct relationship between that versus taking statin drugs. Statin drugs, that's a $12 billion a year industry, and they're not going to go away quietly. And there's a lot of mythology in healthcare. Like, for example, they thought at one time that high cholesterol was the cause of heart disease that led to strokes and heart attacks and early onset death with people.
Hmm.
And now they understand, a lot of cardiologists, they understand the linkage between inflammation and atherosclerosis and early onset uh, death. So, for example, the people that die of heart attack and stroke, when they did a post-mortem examination and they examined their cholesterol levels, 75% of them had cholesterol levels within the normal levels, but they still died of heart attacks and strokes. So
Mm.
clearly it wasn't the cholesterol that caused the problem. So as we go down the rabbit hole together and we learn a little bit more about the root cause of these chronic troubling problems that people have, it all leads down to the basic things: chronic inflammation, oxidative stress, proper diet, exercise habits, things like that.
Yeah, I actually had a conversation about cholesterol with another individual on my podcast, and she was talking about how the inflammation and oxidative stress,
Yes.
cholesterol will actually act as like a helping agent to help kind of like if there's like an issue in the body related to oxidative stress or inflammation, it's trying to like help heal that
It
part of the
is. It
body.
is like
And then they're
the
trying
inner
to
line.
lower the helper, and it's like, okay, that's not helping.
The inner lining of your artery, for example, is called the endothelium, and
Hmm.
surrounding the endothelium is another tissue called the glycocalyx. And when you are chronically inflamed, the endothelium gets red and angry, and it develops little cuts and nicks, kind of like a shaving cut. When you shave your legs or whatever, you develop little cuts, little shaving accidents, and the cholesterol tries to go in there and patch the pothole, tries to correct the problem. Now, the cholesterol then can get subjected to oxidative stress. That
Hmm.
in chemistry, oxidation is when the outer electron leaves the atom and it becomes a free radical. And reduction is when you gain an electron. So when you have an electron that's fleeing the atom, it causes oxidation. The
Hmm.
cholesterol molecules can get oxidized inside the body, and then they can form what's called a foam cell. And the foam cell starts to swell and grow and swell and grow,
Hmm.
and then it can actually close down an artery, and that causes a problem. So every single cell in your body requires a good, healthy blood flow, and it requires a good amount of oxygen. So if you cut off the oxygen and the blood flow to the brain, that's called a stroke. If you cut off the oxygen and the blood flow to the heart, that's called a heart
Heart
attack.
attack.
And if you cut off the oxygen and blood flow to the nerves that go down your legs, then what happens is that those nerves start to shrivel up and die, kind of like a house plant that you forgot to water for a few weeks. So
Mm.
that leads to peripheral neuropathy. So um, when it comes to the problem, what is the root of the issue? Is it the presence of cholesterol, or is it chronic inflammation and then oxidative stress causing foam cell formation? And that's
Yeah.
why medical doctors, like cardiologists, will tell a person at risk of a heart attack or stroke to take a baby aspirin, right? They want to give them a non-steroidal anti-inflammatory drug, or they tell them to take fish oils or eat more salmon or things like that to try to correct the imbalance of omega-6 to omega-3 fatty acids to reduce inflammation.
Mm.
So again, we go back to nutrition, we go back to um,
Absolutely.
inflammation issues.
Can you explain one more time how the cholesterol gets oxidized?
So when you in chemistry, you know the center of an atom is composed of protons and neutrons,
Yeah.
and
Yeah.
it has an electrons that circle around it in an orbit. And the outer ring of electrons, when the electron leaves the atom, that's called oxidation. And so when people want to combat this, they're going to take antioxidants or things that are going to give
Eat
you an
antioxidant foods.
electron donor to make that atom whole again, away from a free radical.
So,
Free radical damage can cause all kinds of heart issues. It can cause macular degeneration, kidney damage, liver damage, all kinds of stuff. So it's a combination, it's a 1-2 combination of chronic inflammation and then oxidation of the cholesterol molecules, which cardiologists now theorize is the cause of atherosclerosis. It's not merely the presence of high cholesterol. There are plenty of people that have elevated cholesterol levels that are perfectly fine. They
Yeah.
live happy, normal lives. Their blood pressure is fine. They don't have tachycardia, which means the heart speeds up, or bradycardia, where the heart slows down.
Hmm.
If they have any signs of any issues that is related to the heart, I will immediately refer them to a cardiologist. I don't monkey around with that stuff. I would happily refer them out.
Hmm.
Again, there's a time and a place for all healing, and functional medicine doctors should have cooperation with medical doctors for the best treatment of their patients. I think
Absolutely.
I don't think that there's any one doctor that has all the answers, and so I will refer out when needed. And but when it comes to heart problems, I think that that's beyond the scope of my care,
Yeah.
and I want to get a cardiologist in on it.
Yeah, absolutely. It's definitely really important for sure. Um, I want to ask another question because I know one of the most like basic labs that doctors get for people to discover if they have inflammation in the body is CRP.
Yeah.
But I've noticed a lot of times that people who look like they would have a lot of inflammation and like they got a lot of symptoms, they're like CRP is normal to normal range to normal ranges, sorry. What are your thoughts on using C-reactive protein is what we're talking about here, on detecting inflammation in the body?
So high sensitivity C-reactive protein is a common test to check for chronic inflammation. It's not just for warning of a heart attack or a stroke. It's for just generally checking chronic inflammation. So if the person has an infection, infection, the CRP is typically going to go up. So I
Okay.
don't hang my hat on any one test. I look for
Yeah.
other markers too that can tell a story. For example, when you order a CBC with a differential, that's a complete blood count with a differential, I oftentimes will look at the white blood cells and look at those numbers too. So if white blood cells are within the normal range, that means that they're typically okay. If the white blood cells are elevated, that means that there's an acute inflammation. If the white blood cells are suppressed or down, that typically means chronic inflammation is going on. So I tell a story to people that when they have a chronic issue, a chronic infection, for example, and the white blood cells are very low, that's kind of like an army that's been in battle for a long time. A lot of those soldiers are going to get killed during the battle. And just like with chronic inflammation, the white blood cells are going to be suppressed because a lot of them have been killed off. So that's how we tell if it's a chronic inflammation. So if they have a decreased white blood cell count and high reactive C reactive protein and high homocysteine levels and other signs of acute phase reactants on their blood tests, that's when I suspect they have chronic inflammation. And there's all kinds of different tests that I can order. So, for example, if I feel that the inflammation is due to an autoimmune disease, I can order some tests called they're by a lab called Cyrex, and they can detect um, if the inflammation or if the autoimmune disease could be due to certain foods that you could be eating or consuming. Other foods have molecular mimicry. So, in other words, they can imitate certain foods that cause high levels of inflammation, or it could be a neurological based thing, or it could be due to a chemical imbalance or exposure. For example, if a person that works in a factory and they're exposed to benzene, or some kind of a toxic element like that, that can cause inflammation in the body. Certain chemical cleaners, things that you use in your house and you think are perfectly fine, your body could be very sensitive to them. So, for example, a kitchen soap or a cleaning agent that you use to clean the bathroom or the furniture. All kinds of things can occur. People can have issues with their carpets, with the formaldehyde that's in the carpet that can cause problems. They can have
Mm.
problems with certain furniture. Certain furniture is made with certain upholstery products that could be damaging to their body.
Yeah.
Inflammation can also be caused by black mold exposure. So if you suspect of black mold exposure, I've had people that had headaches, aches and pains. They had sore throats. They had a lot of wheezing. Nobody could figure out what the root cause was. They would just do a standard panel of tests, and they would say, "I don't know what it is. I don't know what's going on."
Yeah.
And I did a panel of tests to check for black mold exposure. And boom, that's where it was. That's what was causing it. And then they had to hire a mold remediation company to go out there and clean all the mold out of their house, and then they felt better.
Mm.
So it sometimes could be a difficult thing.
Yeah.
Sometimes it requires a little bit of detective work to figure out what the cause of the problem is.
Yeah. A lot of times, especially if it's not like something super straightforward with people, it's like you're a full-on detective trying to figure out what's causing their symptoms. Because yeah, it can come from a lot of different areas. What I personally do is I have a whole like reduced toxic load guide, and I just like share with my clients like all the different ways to help reduce their toxic load overall. Because that it can be, especially if people don't have like thousands of dollars for like labs or anything like that. You
So,
can't be
so I think
testing for a bunch of different things. So reducing
what we
the
what we
load
need
is
to do
definitely
at this
important.
point is to define what toxic load is. So toxins are always around us. Every time you drink water, every time you eat food, every time you breathe the air, every time you expose yourself to the soil, you're putting toxins into your body. Now, the body is a natural detoxifying agent. So your liver, your kidneys, they filter the blood. Your lungs you breathe in oxygen and you breathe out carbon dioxide. That's a form of detox. And your skin is a natural detoxifying agent. So or detoxifying organ. So when you have things like breakouts on your skin, or you have chronic aches and pains, and you have headaches and migraines and low energy, and nobody can figure out what it is, we have to look at the amount of toxins going into the body is exceeding the ability for the body to get rid of the toxins. And that's called toxic load.
Hmm.
So for those of your guests that don't, or your audience that doesn't really understand this, it's about how much is coming in and how much is going out. And when
Yeah.
it comes to toxins, there are two different types of toxins that I work with. One is called water soluble, and one of them is called fat soluble. Water soluble toxins can be very easily excreted out of the body. Every time you go to the bathroom, number one or number two, you're excreting toxins out of the urine and out of the stool. But fat soluble toxins are more stubborn. They tend to cling to the fat cells of your body, and they are very, very stubborn. They don't want to leave. So what a detox formula will do is it transforms the fat soluble toxins into water soluble, so then your body can have a better time excreting it. And then what happens is that you get a better night's sleep. You have more energy for work and for play. You can digest foods better without bloating and distension and an issue with a yeast infection. All kinds of bad things can happen. But that's super important. I'm glad you brought that up because that's a very, very important part of this whole equation. And medical
Yeah.
doctors don't really appreciate that nearly enough.
I honestly, like 99% of my clients have already spent years dealing with doctors, and that's something that my clients, when they come to me, they're like, "Wait, what do you mean?" Like, I haven't heard of that
I,
before.
I know
I'm
exactly
like,
what you're talking about.
that's a really important thing. I wish doctors would. Why do you think doctors don't know more about even just like basic things like toxic load, um, and like
Well, the thing
supporting your
is,
liver health and stuff?
it's not. I don't really think it's because they're bad or evil
Yeah.
people. I just think it's a part of their training. Their residency, which is where most of them get their knowledge, it doesn't include that. Doctors don't really take clinical nutrition. They don't look at things holistically. They use what's called a reductionist form of looking at things. Reductionism was formed by the philosopher Rene Descartes, and so they it breaks everything down to the smallest component possible, and
Mm.
they study that component as an individual entity. Well, the body doesn't work like that. Everything is connected. So your thyroid is connected to your brain, and your sex hormones are connected to your um, your thymus and your pituitary gland and your adrenal gland. So everything has to be appreciated as a connected entity.
Yeah.
And I think really what it boils down to, it's a difference of philosophy. They have a philosophy and I have a philosophy. They're different with respect to what they do. I believe that they're at their best when they're treating acute problems. We are at our best when we're treating chronic disease.
Hmm. Yeah. Do you think that there will ever be a time where doctors start to adapt more of a functional medicine structure?
It's already happened. There are medical doctors like Dr. Mark Hyman, for example. He's a physician. He's board certified in family practice. He practices in Massachusetts.
Yeah, I followed
But
him for a while now, I
yeah,
think.
he doesn't he if you read his stuff, he's all about supplementation, lifestyle modification, looking at hidden root causes of issues. So, and a lot of other medical doctors are starting
Mm.
to take that approach. Dr. Linnell King in Naples, Florida, a very famous doctor there. He's all functional medicine, and his thing is autoimmunity, thyroid, and inflammation. Guess who that sounds like? But Dr. King is a good example of a medical doctor that maybe he took the red pill and he saw the
Yeah.
light,
Yeah.
to
Yeah,
quote the Matrix.
I am seeing some doctors on like social media and stuff starting to like because they have to when they do practice more like functional medicine, they do have to do that separate from like the medical system, correct?
Well, a lot of times the two don't get along and play well with each
Yeah.
other.
Because I know
So
insurance causes a lot of issues, I believe.
the insurance,
Yeah.
well, the insurance, well,
Or is it
one of
insurance or is it like, I don't know, something in the
the
system? What is
well,
your thoughts?
the insurance industry has certainly played a big part in our healthcare that we have today.
Yeah.
So let's say, for example, that you go to see your family doctor and you walk in the door. By the time you've actually walked in the door, that treatment plan has already been predetermined for you. They and it's been created by an actuary that works for the insurance company that sits that works in another city, has never met you, has never looked at your chart, has never read your labs, not done an exam, but he's going to determine what they're going to pay for. So that's why medical doctors order a very narrow bandwidth of tests so
Yep.
that they can arrive at a diagnosis in order for them to prescribe a drug. So they're going to do exactly whatever the insurance company dictates that they will
Yeah.
pay for and nothing else. So if the insurance company is going to pay for a very, very small amount of care, that's what the doctor's going to give the person. And
Hmm.
it's a shame. They should prescribe what the patient needs, not what the insurance will pay for. But that's what
Yeah.
it's evolved to. And that's, by the way, that frustrates a lot of medical doctors that I've talked to. They are
Mm.
apt because they go to school for a long time and they feel that they should be the one calling the shots. But it's really the insurance company that sits in the driver's seat.
Yeah.
And it's a shame. My mother is 92 years old, and she recently went to the hospital. They she had some kind of a thing, and they ordered a chest X-ray. And they said to me that she has double pneumonia. I'm like, okay, well, did you order labs? Yes, they did. So I said to the doctor that was in charge of her case, I said, what did the labs say? Well, her blood tests were fine. She doesn't have elevated or decreased white blood cells. And I'm like, how could she have pneumonia and not have any issues with her white blood cells at all?
Yeah.
And he realized that he was in a lot of trouble because he was talking to somebody that really knew a little bit more than the average guy on the street. So he goes, well, then I will order her I'll stop her antibiotic therapy right away. So they had her on antibiotics, even though there wasn't medical necessity for the antibiotics, because the insurance company told him that there is a certain protocol that you have to run, a certain algorithm that you have to do whenever somebody comes to the hospital. And I think that they do crazy things just because they're told to by some insurance agent.
Yeah.
So the medical doctors, they're stripped of the freedom to practice the way that they want to a lot of
Yeah.
times.
They're not even like calling the shots. They're just doing what they're told to do pretty much.
Yeah, exactly.
Mm,
Exactly.
interesting. This is kind of like one of my last questions probably and kind of a little bit off topic, but you mentioned antibiotics and I know a lot of people have a lot of rounds of antibiotics throughout their life. I've been
Yeah.
very, very fortunate to not have had to get any antibiotics, which I'm very thankful for. Um, Obviously it's life-saving, but I want to know how people can determine if antibiotics are necessary to save their life or if they could take a different route to help reduce the amount of antibiotics that they're taking.
So there's a lot of things that you can do. One of them is a lab test, and the lab test will reveal a lot about your body. Let's say, for example, if all you do is order a CBC with a differential, it'll look at your monocytes, your lymphocytes, your neutrophils, the granulated white blood cells like eosinophils, basophils, neutrophils, or um, um, that kind of stuff. So that's going to determine what's going on. Other times, the doctors can order a gram stain. This goes back to microbiology. They can determine if it's a gram positive or a gram negative bacteria. A lot of medical doctors don't want to be bothered by doing that. So they order a broad spectrum antibiotic, something that's going to kill everything, like Roundup, for example. And one of the issues with that is that antibiotics are not only going to kill the bad bacteria, it's going to kill all bacteria, including
Yep.
the healthy, friendly bacteria that lives in your gut that helps you to not only make stool, but it helps with your immune system function. It helps to make neurotransmitters. It helps with your brain function in a lot of different ways.
Yeah.
And you have to have a healthy, normal microbiome. The microbiome is kind of like a flower garden. So if you have a flower garden and it looks really pretty and really robust, and then you ignore it for about 3 months, what's going to happen?
Probably weeds are going to start growing. Yeah.
Exactly. You're going to get a lot of weed growth, and the weeds are then going to compete with the flowers for a finite amount of natural resources, like
Hmm.
nutrients in the soil and water and sunlight and stuff like that. And then if you continue to ignore it, the weeds are then going to choke out the flowers and start to overtake your flower garden. Now, one of the things that you can do is you could snip the weeds off at the top of the stalk and make it look better temporarily. But when it rains again, guess what's going to happen?
They're going to grow right back up.
They're going to go right back up.
Yep.
So that's why you have to pluck them out by the root, and then you want to plant more flowers. So when it comes to your body, the good, healthy, friendly bacteria are like the flowers, and the bad, opportunistic, pathogenic bacteria are like the weeds. And so when you want to grow more flowers, you take probiotics or you take more fiber or prebiotics and you plant more good flowers in your garden. And then that starts to choke out the weeds. And then you start to normalize the function of your gut and your brain and other parts of your body. It's the same thing. So there's a big component of health that has to do with the gut, and it has to we have to I order a test called a GI map, and that's a
Love that
stool
one.
test, and it measures the amount of good healthy bacteria versus opportunistic pathogenic bacteria versus yeast or parasites or antibiotic resistant genes that are going on in there. It gives you a whole lot of good clinical information about the function of of your body. So by ordering a combination of tests, a combination of blood tests and stool tests, you can really get a good understanding about the function of the gut and about your microbiome.
Hmm. Okay. And if someone, well, that's like a definitely really good, like if you have been taking a lot of antibiotics, definitely replenish your gut microbiome, see like get a GI map to see what your bacterias are if you have any pathogens in there. For people kind of thinking about wanting to prevent having to take antibiotics as much as they can, how can people tell like, okay, I need to take antibiotics to save my life versus I don't actually need antibiotics and I could probably take more of a natural route or some sort of other supplement or medication?
So, first of all, I don't think that people can determine that for themselves. You need a medical doctor
Yeah,
to help you
absolutely.
to do that. But
Like, for
the
example,
medical
I'm thinking like sinus infection. A lot of people take antibiotics for sinus infections. A lot of people take antibiotics for just like colds.
Mhm.
Because a lot of times doctors tell you to. How can you know like if because doctors are going to tell you to take it anyway, and it's really difficult to understand if it's a necessity or not. That's kind of like what I'm trying to get at, if that
Okay,
makes
so
sense.
yeah, so antibiotic therapy is useful for controlling a bacterial infection. However, when it comes to if it's a viral infection, they're completely worthless. Antibiotic therapy cannot cure a virus. They cannot cure a viral infection. And so, first of all, it has to be determined if you have a bona fide bacterial infection. And if you don't, there's no medical necessity for ordering this. And there's been a lot of fights in the healthcare arena around kids' ear infections. A lot of children, they develop a lot of ear infections. And
Hmm.
so back in my day, I'm pretty old. So back in my day, the doctors would routinely cut the tonsils out of the throat. They thought that the tonsils were a worthless appendage. It had no health benefits whatsoever, and so they would remove the tonsils and the adenoids. If you looked at the doctor sideways, they would snip out your tonsils. Now they're realizing that the tonsils actually have a health benefit, and there's an increase in the amount of throat cancers among people that had their tonsils removed. So it's not necessarily the presence of the tonsils that was the root cause of the ear infections. There's a lot of ear infections, probably 90% plus, that are serous infections. That means that there's no bacteria present whatsoever. The water or the fluids that are behind the eardrum, those are completely sterile. That means there's no bacteria in it whatsoever. And really, what the root cause is that the eustachian tube, that's the tube that connects the ear to the throat, got a mucus plug stuck in it, and it got plugged up, and it caused a lot of pressure to build in the middle of the ear. And the ear, nose, and throat doctors were like amazed by this. Like, you mean they don't need to prescribe antibiotics like they want to? Nowadays, they put tubes in kids' ears. And I wonder how many of those are actually clinically necessary to do. But you're asked about sinus infections. The
I was just
doctor,
giving an example. Correct me if I'm wrong, but doctors do prescribe antibiotics for things like that, right? Even if it's not necessary.
yes, they do. So
Okay. I was
medical
like, am I
doctors
totally
will
mistaken right now?
medical doctors will often throw drugs at a problem
Okay.
because in a large part because the person feels that if they walk out of the doctor's office without a prescription, they are leaving empty-handed and they don't like it. So a lot of times it's just to appease people and to allay their fears. But like there's a woman that came to my networking group and she said that she had a a, it was a throat infection or something, and the doctor gave her a Z pack. And I'm like, well, did he do a proper workup first, or did he just give you the Z pack? That's a type of antibiotic therapy. And I knew what the answer was before she said anything. But I think that if you do a proper workup and you understand what's going on, then you can thoughtfully and appropriately prescribe the right drug for the right problem and the right time. And if you don't do it, you're not doing anybody a service. You're doing them a disservice. And I'm not going negative on antibiotic therapy. I think
Yeah.
that it's very useful
Me either.
if you have a problem that
Yeah.
requires that type of therapy. But if you have a bacterial infection, there's no reason at all to give the person an antibiotic. Viruses cannot be killed by an antibiotic. Antibiotics only can work with bacteria.
Mm-hmm.
And by the way, anytime that a doctor gives you an antibiotic, after you're done taking your drugs, you need to take a probiotic to re-inoculate your gut with healthy bacteria.
Yeah, absolutely. Well, thank you for sharing that information. I want to end a little bit for like advice for the listeners here. So, for people who have been listening, who have been taking prescriptions for very many years, maybe they've seen a little bit of difference, maybe their health is just getting worse. Where would you say is the best place for them to start exploring a different place or a different path? Sorry.
Well, they can reach out to a functional medicine practitioner that's close to you, or you can come visit my website if you want to learn more. I have a little bit of information on my website, which is metabolicsolutions.net. And from there, you can read about different problems that people have that I help with. Or you can, if you want to find out what's going on with your body and understand a little bit more about what can be done. If you've already gone to the medical doctor or been to many medical doctors and you're not happy with the therapy approach that they have done, give me a call. You can give me a call. We can do a discovery call, which is an informal and completely free 10 to 15 minute phone conversation where you can tell me what's going on and what you've already tried, and then I can give you my best recommendation for helping at that point. You can reach out to me at area code 412-595-7332. And if I'm not there or if I'm with a patient, just leave a message. I'd be happy to talk to you. And or you can visit my website at metabolicsolutions.net. But a lot of people, they really want to get fast help. So just give me a call at 412-595-7332, and I will listen to your story and we'll talk about what you're up against, what challenges you have, and what your goals are. And then I'll give you my best recommendations for helping to devise an action plan so you can live a happier life.
Amazing. Well, Dr. Smith, thank you so much for sharing your experience and giving us such a powerful reminder that even if the medical system hasn't been able to help you in healing from chronic disease, there's something else that you can try. If today's episode sparked something in my listeners, definitely share it with a friend who's been searching for answers beyond medication. And you can learn more about Dr. Smith. I'm going to link his website and how to contact him down in the description notes below.
Rachel, thank you very much for having me on your show. It was an honor and a privilege to be with you and to share a little bit of information with you tonight.
Yeah, absolutely. Thank you so much. Thank you for listening to another episode of the Experience Health Podcast. I'll see you guys next week. Thanks for listening to another episode of the Experience Health Podcast. If you enjoyed this episode, be sure to follow for more. If you have a question, feel free to shoot me a DM on my Instagram at healthbyrachel with 2 A's. Until next time.